Good morning. Good 2-degree outside Tuesday morning for Tidbit Tuesday. Melissa Reitman, Pelvic Health Physical Therapist, Pathways Physical Therapy and Holistic Health. We are here today to talk about bladder health again, to continue our topic. And today's topic will be that little pesky leakage when we cough or sneeze or laugh. The thing that we sort of shrug off and say, you know, that's really common. You had a baby, you're a little bit older, you had a hysterectomy, you had a this or that. And there's truth to that. There are things that happen in our life that do, make us more susceptible to perhaps having that issue. But as we love to say in the pelvic health world, it is common, not normal. It's a sign of dysfunction if your bladder and your pelvic floor muscles are not able to hold your urine when it needs to. Unfortunately, I can't tell you, here's what you're going to do to fix it right here on the video, and that's because we are complex individuals and each of us may have a little bit of a different reason as to why that's happening. So the general idea out there that people will throw around is that you're weak and so you can't hold your urine and so you need to do Kegels in order to not have incontinence. There may be truth to that, but that is not always the case because if your muscles are really tight, they're also not going to work correctly. Think about if you were to hold your fist for a very long time pretty tightly and then tried to use a pen. It's not that your hand becomes weak, it's that the muscles become fatigued and they cannot work in the proper way that they need to work. And so our pelvic floor muscles may be really tight and weak, and so just doing Kegel exercises might not be the answer. There is one trick that I can give you that may help if you do have this issue, and that is if you have any warning, if you know that you're going to cough or sneeze, if there's any warning before that, you're trying to do a Kegel, trying to grasp those pelvic floor muscles together before that may help to prevent that issue. I do recommend, though, if you have that problem, to seek some help because it is something that may be just a little laughable, maybe a little dribble, but if it's kept unchecked, it can become a more significant problem over time. And so we'd like to help you not get to that point. So remember, do that little quick contraction before you cough, sneeze, or whatever it is you do when you have the leak. And also maybe seek some help. Find out, are you tight, are you weak? Does your breathing pattern have a role in that? Because there are many different factors. So, Melissa Reitman, Pelvic Health Physical Therapist with Pathways, and you can reach us at pathwaysdurango.com or you can comment on our link. Have a great day and stay warm.